Principles of functional medicine and personalized health. Functional medicine is a game changer, at least it was for me. It was a game changer in the healthcare field, particularly for those dealing with chronic disease. This model is individualized, patient-centered, science-based approach that empowers you to take an active role in your healthcare. It makes you responsible for you. And in this lesson, we'll delve into the 4 key concepts that make functional medicine a standout approach to maintaining optimum health. What is functional medicine? Functional medicine is a holistic approach that focuses on individualized care and identifying root causes rather than just treating disease. Still based on traditional medicine, but we just put in the holistic part into it. These are the 4 principles of functional medicine. They all contribute to a fuller, more effective approach to healthcare. The first one is individualized care. What does it mean exactly? The notion of individualized care is at the core center of functional medicine, meaning no 2 people, no 2 bodies are alike. And thus, the treatment for anything should be tailored to that individual person's unique circumstances, genetic makeup, and lifestyle. Why does it matter? Personalized treatment plans mean a more effective treatment. By tailoring the approach to you, the likelihood of positive outcome goes up. One of the things that you can do is reflect on a previous healthcare experience, one where you saw a doctor maybe recently, and you can just sort of reflect, was your interaction a personalized one, or was it more of a one-size-fits-all? Record your thoughts on your journal, and maybe if you want to share in the forum, that would be great. I know when I was practicing, I had almost like a script that I used to do for every single patient, no matter who they were. And I only changed that once I started to learn about functional medicine. And I know a lot of the doctors practice that way. They just have a script that they go through, questions that they end, and then try to figure out what the diagnosis is. All right, number 2, root cause analysis. So what is it? So rather than merely treating the symptoms, functional medicine aims to get to the root cause of whatever chronic or disease is that we're trying to address. This involves a comprehensive diagnostic process and an in-depth conversation between you and the healthcare provider. Why does it matter? Because to understand the root cause of the condition, it is crucial to give you an effective treatment. If we understand what's causing it, we'll be better able to treat it. It's the difference between patching a leaky roof and fixing it from the inside out. So think of a symptom you've experienced recently. What are some of the potential root causes? Note them down in your wellness journal. Number 3, a holistic approach. And I think this is really the biggest difference from functional medicine. So what is a holistic approach? Functional medicine looks at the body as a connected system. Traditional medicine looks at individual parts, your heart, your kidney, your just parts. Where functional medicine looks at the whole entire system, because we know it's connected. Physical, emotional, and mental aspects are considered when assessing your health. Why does it matter? Because our body functions as one system. We have one body. It's not all different parts, individual parts, not isolated compartments. A holistic view enables a comprehensive care, making sure nothing is overlooked. So one of the things that happens in functional medicine is that we look at what brought you to this point in your life. We start looking at your life from the time you were conceived to now. So we want to know what happened to your mom when she was pregnant with you. Was there anything unusual? Anything that happened during that time that can affect you? Then we look at your early childhood years. Is there anything that happened then? And not just health issues, not just infections and treatment with antibiotic, but we look at big life changes, divorces, moving around a lot, whatever it is. We look at all stages of your life up until this point to see what contributes to whatever disease is that's present. Reflect on how your emotional and mental states affects your physical well-being. So we know that when we're like down and feeling depressed or anxious or not that well, we know people feel more pain. Note these examples in your wellness journal. Reflect back on your own health and what your emotional and mental state affects you, how it affects you overall. All right, number 4, preventive care. Functional medicine places a strong emphasis on preventive care, focusing on lifestyle modification like diet, exercise, and stress management to halt the progression of your chronic disease, or even better, to prevent it in the first place. Preventive care is proactive rather than reactive. We don't wait until you have more symptoms to then start treating you. We want to try to prevent it by lifestyle medicine. So it empowers you to take control of your health, potentially avoiding chronic diseases altogether, or even managing your present condition better. In thinking about your present health, whether you have a chronic disease or not, think about 3 lifestyle changes you could make that would have a positive impact on your health, whether it's to prevent chronic diseases or to improve the management of those diseases. These 4 pillars are individualized care, root cause analysis, holistic approach, and preventive care. This is what makes functional medicine unique and powerful in treating chronic diseases. As you explore these concepts further, you'll discover they offer practical, effective ways to improve your overall health and well-being. Okay, so I want to go over a case study of a person with diabetes and how the approach to her diabetes through functional medicine actually made it possible for her to reverse her type 2 diabetes. One thing that you should keep in mind is in diabetes, we know that the first 10 years are critical. This is a window of opportunity for you to reverse diabetes. Once you pass the 10-year mark, we know that the damage and complications from diabetes have damaged you beyond the point where you can't reverse diabetes. Focusing on those first 10 years is really important. Keep that in mind as we go through this case. So we're going to call her Sandy, not her real name. When I met her, she was 52 years old. She was diagnosed with type 2 diabetes and had been diagnosed with type 2 diabetes for 3 years. Despite taking 2 medications and following the conventional treatment, her condition seemed to be getting worse and not better. She was really frustrated. She really wanted to get off her medications. One of them was giving her a lot of side effects. I decided to help her through functional medicine along with her medical provider. The doctor was not a functional medicine doctor, but was learning a lot about it. She decided to do a whole bunch of lab tests on this patient, which was great. So she was mirroring what a functional practitioner would do. Rather than solely just focusing on her symptoms, she did a broad spectrum of tests. And at the same time, I did a full assessment of her lifestyle, her diet, her stress level, and even her emotional well-being. So between the doctor and I, we came up with an individualized plan for Sandy. After the comprehensive test and the assessment, we found out she had a whole bunch of problems that could be part of the root causes of her diabetes. She had a poor gut health. She did not exercise at all. She did try to eat better, but her diet wasn't that bad, but exercise was not part of her daily routine. She had a high stress job that was contributing to her diabetes, and she had some personal issues that were going on in her marriage. When we started her on this unique plan for her, we tried to address everything from the mental, emotional well-being, and the physical. So we switched Sandy to a low glycemic, anti-inflammatory diet, rich in vegetables, lean in protein, lots of protein, because again, she was 52. She also started to eliminate processed foods and sugar, especially sugary food. She used to have a lot of cravings. So trying to slowly eliminate those processed foods really helped. We gave her an exercise plan where she started very slowly. She started walking 3 times a week for 10-15 minutes, and then slowly increased it to where she was doing about 30 minutes per day. And then we switched to 5 days of 30-minute walking and 2 days of weight exercises or resistance. We did this very slowly, focusing, making sure that she could continue to do it and that it would become something that she did all the time, a regular thing. The exercises that we gave her were designed to help her, 1, lose weight, and 2, improve her insulin sensitivity. Aerobic exercise, the walking, was really focusing on the insulin sensitivity. And then the weight exercises was focusing on building better muscle and the weight loss. We also put her on a stress management routine. She incorporated mindfulness and relaxation techniques throughout her day to manage her stress better. We also found that she had some nutritional deficiency. We put her on some supplements. But remember, supplements are just temporary until she can boost her nutritional intake to address those deficiencies long term. And then the result was that after 6 months following this approach, she lost enough weight to normalize her sugar, to get off at least one of her diabetes medication, the one that was causing her the most side effects, and reducing the dose of the other one. And she wanted to continue to see if she could completely get off the medication. She lost weight, gained energy, but she also reported feeling overall well as far as her emotional and mental health. So she was feeling overall better. So this is just a quick case in a quick view of how functional medicine would approach type 2 diabetes. In the few remaining minutes that we have, I'm going to introduce Module 2 to you. In Module 2, we're going to be talking about physical health and chronic management, chronic disease management. Understanding the diseases and how they come up for most women is really important because that helps you sort of focus on prevention. Let's start with diabetes. What is diabetes? Diabetes is a condition that affects your body's ability to process common carbohydrates and, more to the point, starchy carbohydrates or sugar carbohydrates. The most common type of diabetes that affects women over 40 is type 2 diabetes. The main character is that you have insulin resistance. So what puts you at risk for diabetes? Age is one of them. We used to say age over 40. Now we're saying over 35 years of age will increase your risk for getting diabetes. Your lifestyle. If you like exercise, you have a poor diet, and you're obese, that all puts you in a higher risk category for getting type 2 diabetes. Also, if you have family history, especially first type relatives like your mom, your sister, that puts you at a higher risk, but only by 25%. Most of the bigger risks come from your lifestyle and your age. Unfortunately, we can't do much about the aging, but we can do a lot about health, your lifestyle. All right. Traditional medicines are often prescribed to manage blood sugar. Things like metformin and other medications. There are newer medications that have been in the news a lot, also are being used for weight loss. While these medications can help you get started, once you do it, you need to continually take the medication. So we want to get you started on the medication to reduce the sugar and reduce the complication, but we want you to focus on the actual root causes of what's causing your diabetes. We like approaches that emphasize your diet, like incorporating a low glycemic, anti-inflammatory diet, incorporating exercises that are focusing on aerobic exercises, and also some resistant exercises because of our age. Cardiovascular issues. This is another one that is increased after 40, especially after menopause. The heart of the matter is cardiovascular issues like hypertension, heart disease, and arrhythmias are often called silent killers because they don't really have symptoms. You may not even know that you have it. But some of these risk factors are high cholesterol levels, especially what they call the bad cholesterol or your LDL cholesterol. Obesity. Being overweight can increase your risk for heart disease. Excess weight puts a strain in your heart. Stress. Chronic stress levels increase cortisol and other hormones and can cause damage to your heart. A lot of times when you have heart disease, they'll give you medications like statins and blood thinners, especially if you have arrhythmias, they'll give you blood thinners. But again, we want to focus on the things that are going to make the biggest impact, which is your lifestyle. Balanced diet, rich in omega-3 fatty acids, regular exercise, and stress management techniques through things like meditation is what's going to give you a big impact. Autoimmune conditions. So understanding your autoimmune condition is really important. Autoimmune conditions like rheumatoid arthritis, lupus, Hashimoto's thyroiditis, they occur when your body mistakenly attacks itself, right? It's really important to understand your disease and how to manage it. Genetics plays a part. A family history can increase your risk, but it's your environmental factors that can have a bigger impact on autoimmune disease. Things like infections, chemical can trigger your response to increase your body's response to attacking itself. What's the management? The most important thing is suppressing the attack through medications to control it, but also to understand what are your triggers. If you can take away those triggers, you take away your body's attack on itself. To control symptoms, you want pain management a lot of time. For conditions like rheumatoid arthritis, those are like key things. But When you dive deeper through functional medicine, you really want to identify your triggers through comprehensive testing and keeping a journal, a wellness journal, a health journal. Really individualize your treatment, like your diet. There are different diets for different autoimmune diseases that you might want to look into. Certain supplements can aid, and of course, lifestyle intervention is always very, very important, like managing your stress. Remember, knowledge is the first step toward empower wellness, but it's not the overall thing. What you need to do is actually take action. Thank you for joining today. Remember, the journey to empower wellness starts with a single step. And you've already taken it by being here. Until next time, stay positive and resilient.